high school? Do you suffer from stress? If so, we have a great solution to help you manage your stress. Stress is a risk factor for many health issues, including schizophrenia. However, the good thing about stress is that it is a modifiable risk factor, which means it is something you can work to fix. Our goal with this presentation is to first help relieve your stress and second to help educate you on schizophrenia. Schizophrenia is a huge problem in society today due to lack of knowledge. Our program, Press to De-Stress, will help resolve your stress and allow for coping mechanisms. You may be wondering what schizophrenia is. Don't worry, because we're about to tell you all the things you need to know, as well as our fun and innovative program, Press to De-Stress.
Schizophrenia is defined as a chronic mental disorder that leads to a disconnect between thoughts, actions, and behaviors. Symptoms are typically described as positive or negative. Negative symptoms are those that can be found in people who have not been diagnosed with a disorder, such as the lack of desire or motivation to accomplish goals, lack of desire to form social relationships, and blunted affect and emotion. Positive symptoms are found in people diagnosed with a disorder, such as hallucinations, delusions, and thought disorders. Common risk factors may include increased stress, drug use, and having a family history of schizophrenia.
An imbalance in neurotransmitters can contribute to the symptoms of schizophrenia. People develop schizophrenia because of a mix of genetic and psychosocial factors. Schizophrenia affects 21 million people in the entire population, which is less than 1%. And is usually diagnosed in a person's early 20s. It typically affects men more often and more harshly than women. There are no tests used to diagnose a person with schizophrenia. A diagnosis is best completed by a psychiatrist who conducts interviews with the patient as well as their friends and family. For an accurate diagnosis, symptoms have to be present for at least 6 months and the patient must be significantly impacted. The symptoms cannot be explained by drug use or another mental illness. There are several other mental illnesses that have similar symptoms that can lead to a misdiagnosis, such as bipolar disorder and major depression.
With schizophrenia, patients are typically treated with medication. They must work with their doctor to find out which medications work best for their symptoms. Patients are also recommended to go to therapy, which will help them to develop skills such as interacting with others so they can go about living normal daily lives. Being diagnosed with schizophrenia also comes along with stigmas. Schizophrenics can be seen as dangerous or incompetent, having a lower quality of life, low treatment compliance, low self-efficacy. They can be seen as depressed or having social anxiety, as well as having a diminished feeling of hope. But many of these stigmas are untrue for most patients.
We have come up with a few prevention ideas. High school is a very important time for development, and while stress is not the only factor leading to schizophrenia, it is an important one. This doesn't mean that if you are stressed about an assignment or a test, you immediately run the risk of becoming schizophrenic. However, chronic stress and anxiety can increase your chances of developing the disease. It is recommended to get at least 150 minutes of moderate exercise every week. Keeping a planner or making a to-do list can help a person stay organized and avoid procrastinating. Also, it is best to aim for 8 to 10 hours of sleep every night. JMU students in the Impact of Chronic Illness course are starting an initiative for high school students to manage their stress level and reduce their overall anxiety. We would like to invite students to press to de-stress by making simple stress balls. Making stress balls only involves a balloon and some rice. First, blow up the balloon to stretch it out slightly, then fill the balloon with rice until it is a size that fits comfortably in your hand. Then tie the balloon off and your homemade stress ball is ready to use. Other options if rice isn't available for you would be lentils, beans, or flour.
There are several grants and research funding for schizophrenia. NSA will help be funding this project, Press to De-Stress, by donating supplies to make stress balls. Other research funding and grants are listed in the references below.
If you feel like you may be suffering from one or more of the symptoms discussed in this video, here are links that give more details on schizophrenia. If these symptoms are impacting your daily life, then seek help from a medical professional.
Created using Powtoon.